Action. Okay, good morning, Sam.
I'm Samuel Curcio, 78 years old, and I'm from Freehold, New Jersey. And age 16, I had an auto accident which fractured my knee. And after recovery, I went into the military for 40 years and come out. And after the year, through the years, my knee started to deteriorate. I mean, I could get around very good, but I couldn't, do too much walking.
Okay.
So I finally decided now's the time to do something about it. So I went to see Dr. Nasar, and he did the surgery, and I'm very pleased with it.
So you had a total knee replacement of your left knee, and that was done a little over a week ago.
27th October.
Okay. And before that, you were having some problems getting around and some pain. I mean, is that basically the story? Had you tried any other treatments for your knee?
Yeah, well, I had cortisone treatments, Doc, but they didn't work.
It didn't work. And then you decided to have a knee replacement surgery.
Right.
And why did you choose Dr. Nasar and Central State? Do you remember?
I don't know. Your ad in the telephone book looks so attractive. I said, this is a guy,
Okay, all right, fair enough. Okay, and we're now after the surgery. So can you just tell us, what it was like as far as the recovery?
But can I put in one thing?
Yes.
I came to see you in March.
Right.
And we decided for the surgery. In the meantime, right after that, I chickened out.
Yes, I remember.
And I tried to, I thought maybe my knee would mend itself, but I found out different. I found out it was getting worse, so I finally called Dr. Nasar again and see if he would accept me back as a patient, and he did.
I'm not going to abandon you, Sam.
No.
So you had the replacement. Just tell us, again, people are always concerned about the hospital experience and about the pain, especially after a surgery like this. Can you just, explain what it was like for you?
At Center State?
Yeah, at Center State.
After surgery, I found very little pain.
Mm-hmm.
And everything was very comfortable. I mean, the treatment was great.
And you were at the hospital for 3 days, correct?
3 days.
And then you were
was transported here to
Center.
Care 1.
Yeah, right now we're at Care 1 in Jackson.
Care 1 in Jackson.
And you've been here less than a week then?
Less than a week.
And how are things here? What have you been doing?
Up to today, after a week, I'm walking with a cane.
Right. So that's pretty good. I'm impressed. Are you impressed?
And if I want to prove it, I can.
Okay, we'll prove it. So we have our therapist.
Cane down, and I walk without it.
Not yet, Sam. Okay, so we're going to try a cane, and this is the first day that Sam is using a cane, and we have our therapist here. And all right, why don't we give it a try? Okay. Well, thanks for going along with this. And up he goes.
Up it goes.
So, any discomfort? I mean, you're feeling real good?
We're very comfortable. No pain.
All right, let me get in front of you so we can see you walk.
No pain whatsoever.
And you're walking pretty evenly, too. That looks good, Sam. All right, why don't you turn around? I think we proved our point. Yeah, you look real good, Sam. So let me ask you a question, Roy. How does Sam look, compared to other patients here? Do you think, is just to tell, because we're going to be showing this video, is this out of the ordinary, or is this pretty much what we expect? Or, how does he compare to the other patients?
Based on our experience, everybody who comes here under your care, the recovery is faster than the other ones. The average stay here is usually less than 2 weeks. The range that we get from them is very wonderful. Like, it's always beyond 70 degrees and there's no pain. most of the patients that underwent on your care always say no pain, whereas on other doctor they usually said they have pain. You know, we are very surprised. Like most of your patients saying no pain, even the total hips, the total knee, were very amazed on the report saying no pain on the day one that they come here.
Yeah.
It's like 2-3 days pause off. To say no pain is really wonderful.
Well, thanks. And you agree with that also, Sam? You really
yes.
haven't had much pain here?
No.
Okay, well, that sounds like a pretty good endorsement. I really appreciate that. Okay, thanks for being on camera for me, Sam.